Hi everyone, welcome back to my YouTube channel. In today's video, I will be talking about the portion of CMS Proposed Rule for fiscal year 2024 Hospital Inpatient Prospective Payment System and Long-Term Care Hospital Prospective Payment System that is relevant to the Hospital Quality Reporting Programs. Hospital Inpatient Quality Reporting or IQR Program. The Hospital Inpatient Quality Reporting or IQR program is a pay-for-reporting quality program. Hospitals that do not submit quality measure data or fail to meet all hospital inpatient quality reporting program requirements are subject to a 1/4 reduction in their annual payment update under the Inpatient Prospective Payment System. In the fiscal year 2024 Inpatient Prospective Payment System / Long-Term Care Hospital PPS Proposed Rule, CMS is proposing to adopt 3 new quality measures, remove 3 existing quality measures, and modify 3 current quality measures. CMS is also proposing 2 changes to current policies related to data submission, reporting, and validation, as well as requesting comment on the potential future inclusion of geriatric measures and a potential future public-facing geriatric hospital designation. Specifically, CMS is proposing to adopt 3 new electronic clinical quality measures or ECQMs to the list of ECQMs from which hospitals can self-select to meet the ECQM reporting requirements for a given year. First is Hospital Harm Pressure Injury ECQM, with inclusion in the ECQM measure set beginning with the calendar year 2025 reporting period / fiscal year 2027 payment determination. Second is Hospital Harm Acute Kidney Injury ECQM, with inclusion in the ECQM measure set beginning with the calendar year 2025 reporting period / fiscal year 2027 payment determination. Third is excessive radiation dose or inadequate image quality for diagnostic computed tomography or CT in adults hospital level inpatient ECQM, with inclusion in the ECQM measure set beginning with the calendar year 2025 reporting period / fiscal year 2027 payment determination. CMS is proposing to modify 3 current measures. Hybrid hospital-wide all-cause risk standardized mortality measure beginning with the fiscal year 2027 payment determination. CMS is proposing to modify this measure to include Medicare Advantage admissions. Second is hybrid hospital-wide all-cause readmission measure beginning with the fiscal year 2027 payment determination. CMS is proposing to modify this measure to include Medicare Advantage admissions. COVID-19 vaccination among healthcare personnel measure beginning with the Q4 of calendar year 2023 reporting period / fiscal year 2025 payment determination. The prior version of this measure reported on the primary vaccination series only, while the proposed measure update would report the cumulative number of healthcare personnel who are up to date with recommended COVID-19 vaccinations to align CMS programs with the Centers for Disease Control and Prevention's definition of up-to-date vaccination, keeping the measure relevant if future vaccination guidance evolves. CDC vaccination guidance can be found at the link that you are seeing on this slide. This link is also available in the description box down below. This measure modification is a cross-program proposal for the Hospital Inpatient Quality Reporting Program, PPS Exempt Cancer Hospital Quality Reporting Program, and the Long-Term Care Hospital Quality Reporting Program. CMS is proposing to remove 3 measures. First, hospital level risk standardized complication rate following elective primary total hip arthroplasty and / or total knee arthroplasty measure beginning with the fiscal year 2030 payment determination. CMS is proposing to remove this measure from the Hospital Inpatient Quality Reporting Program in conjunction with the proposal to adopt the updated measure in the Hospital Value-Based Purchasing Program. Second is Medicare spending per per beneficiary hospital measure beginning with the fiscal year 2028 payment determination. CMS is proposing to remove this measure under the Hospital Inpatient Quality Reporting Program in conjunction with the proposal to adopt the updated measure in the Hospital Value-Based Purchasing Program. CMS is also proposing to remove the measure of elective delivery prior to 39 completed weeks gestation. Percentage of babies electively delivered prior to 39 completed weeks gestation measure, also known as PCO1, beginning with the calendar year 2024 reporting period / fiscal year 2026 payment determination. CMS is proposing to remove this measure because measure performance is so high and unvarying that meaningful distinctions and improvements in performance can no longer be made. That is topped out. While CMS recognizes disparities persist in maternal health, CMS believes removal of the elective delivery measure will allow for additional meaningful maternal health outcome measures in the future. In the fiscal years 2022 and 2023, Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System Final Rules, CMS adopted several measures focused on maternal health, including the maternal morbidity structural measure, the cesarean birth ECQM, the severe obstetrics complications ECQM, and finalized the creation of the birthing friendly hospital quality designation. CMS is proposing modification of the Hospital Consumer Assessment of Healthcare Providers and Systems or HCAHPS survey measure beginning with the calendar year 2025 reporting period / fiscal year 2027 payment determination. These updates include 3 new web-first modes of survey implementation, removing the service prohibition on proxy respondents, extending the data collection period from 42 to 49 days, limiting the number of supplementary survey items to 12, requiring the official Spanish translation for Spanish language preferring patients, and removing 2 administration methods that are not used by participating hospitals. In addition, CMS is requesting comment from stakeholders on the potential future inclusion of 2 geriatric measures, the geriatric hospital and geriatric surgical structural measures. CMS is also requesting comments regarding the potential future establishment of a publicly reporting hospital designation to capture the quality and safety of patient-centered geriatric care. Medicare Promoting Interoperability Program. In 2011, CMS established the Medicare and Medicaid EHR incentive programs, now known as the Medicare Promoting Interoperability Program and the Promoting Interoperability Performance category in the merit-based incentive payment system to encourage eligible professionals, eligible hospitals, and critical access hospitals to adopt, implement, upgrade, and demonstrate meaningful use of certified EHR technology, also known as CERT. CMS is proposing the following changes to the Medicare Promoting Interoperability Program for eligible hospitals and critical access hospitals. Modify requirements for the safety assurance factors for EHR resilience or safer guides measure to require eligible hospitals and critical access hospitals to attest yes to having conducted an annual self-assessment of all 9 safer guides at any point during the calendar year in which the EHR reporting period occurs, beginning with the EHR reporting period in calendar year 2024, in order to satisfy the definition of a meaningful EHR user under Title 42 Code of Federal Regulation 495.4. Amend the definition of EHR reporting period for a payment adjustment year for participating eligible hospitals and critical access hospitals to define the EHR reporting period in calendar year 2025 as a minimum of any continuous 180-day period within calendar year 2025. Amend the definition of EHR reporting period for a payment adjustment year for eligible hospitals that have not successfully demonstrated meaningful EHR use in a prior year to remove the requirement to attest to meaningful use by October 1st of the year prior to the payment adjustment year, beginning with the EHR reporting period in calendar year 2025. Modify the response options related to unique patients or actions for objectives and measures for the Medicare Promoting Interoperability Program for which there is no numerator and denominator and for which unique patients or actions are not counted. The response option would read NA measure is yes, no. Adopt 3 new ECQMs for eligible hospitals and critical access hospitals to select as one of their 3 self-selected ECQMs in alignment with the Hospital Inpatient Quality Reporting Program beginning with the calendar year 2025 reporting period. Hospital Harm Pressure Injury ECQM, Hospital Harm Acute Kidney Injury ECQM, and excessive radiation dose or inadequate image quality for diagnostic CT in adults, hospital level inpatient ECQM. PPS exempt Cancer Hospital Quality Reporting or PCHQR program. The PCHQR program is a quality reporting program for the 11 cancer hospitals that are statutorily exempt from the inpatient prospective payment system. CMS collects and publishes data from PPS exempt cancer hospitals on applicable quality measures. In the fiscal year 2024, Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System Proposed Rule, CMS is proposing the following. Begin public display of the surgical treatment complications for localized prostate cancer measure beginning with data from the fiscal year 2025 program year. CMS is also proposing to adopt 4 new measures for the PPS exempt cancer hospital quality reporting program. Facility commitment to health equity beginning with the fiscal year 2026 program year. Screening for social drivers of health beginning with voluntary reporting in the fiscal year 2026 program year and mandatory reporting in the fiscal year 2027 program year. Screen positive rate for social drivers of health beginning with voluntary reporting in the fiscal year 2026 program year and mandatory reporting in the fiscal year 2027 program year. Documentation of goals of care discussions among cancer patients beginning with the fiscal year 2026 program year. Modify the COVID-19 vaccination among healthcare personnel measure in alignment with the Hospital Inpatient Quality Reporting Program and Long-Term Care Hospital Quality Reporting Program. Modify the data submission and reporting requirements for the HCAP survey measure beginning with the fiscal year 2027 program year. Hospital Readmissions Deduction Program. The Hospital Readmissions Deduction Program is a value-based purchasing program that reduces payments to hospitals with access readmissions. It also supports CMS's goal of improving health care for patients by linking payment to the quality of hospital care. CMS is not proposing any changes to the Hospital Readmissions Deduction Program. CMS notes that all previously finalized policies under this program will continue to apply and refer readers to the fiscal year 2023 Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System Final Rule 87 Federal Register 49081 through 49094 for information on these policies. Hospital Acquired Condition or HAC Deduction Program. The HAC Deduction Program creates an incentive for hospitals to reduce the incidence of hospital-acquired conditions by reducing payment by 1% for applicable hospitals that rank in the worst performing quartile on select measures of hospital-acquired conditions. In the fiscal year 2024, Inpatient Prospective Payment System / Long-Term Care Hospital PPS Proposed Rule, CMS is proposing to establish a validation reconsideration process for hospitals that fail to meet data validation requirements beginning with the fiscal year 2025 program year. affecting calendar year 2022 discharges. CMS is also proposing to modify the targeting criteria for data validation to include hospitals that received an extraordinary circumstances exception or ECE during the data periods validated beginning with the fiscal year 2027 program year affecting calendar year 2024 discharges. In addition, CMS is requesting comment from stakeholders on potential future measures that would advance patient safety and reduce health disparities. Hospital Value-Based Purchasing or VBP program. The Hospital VBP program is a budget-neutral program funded by reducing participating hospitals' base operating DRG payments each fiscal year by 2% and redistributing the entire amount back to the hospitals as value-based incentive payments. In the fiscal year 2024 Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System Proposed Rule, CMS is proposing to adopt substantive measure modifications to the MSPB hospital measure, including allowing readmissions to trigger new episodes beginning with the fiscal year 2028 program year. CMS is also proposing to adopt substantive measure modifications to the hospital level risk standardized complication rate following elective primary total hip arthroplasty and/or total knee arthroplasty measure, including adding additional mechanical complication ICD-10 codes to the measure beginning with the fiscal year 2030 program year. CMS is also proposing to adopt the severe sepsis and septic shock management bundle measure in the safety domain beginning with the fiscal year 2026 program year, and also to adopt changes to the administration and submission requirements of the HCAP survey measure beginning with the fiscal year 2027 program year. CMS is proposing to adopt a health equity scoring change for rewarding excellent care in underserved populations such that a health equity adjustment would be added to hospitals' total performance scores or TPS based on both a hospital's performance on existing hospital value-based purchasing program measures and the proportion of individuals with dual eligibility status that a hospital treats. As part of this proposal, CMS is also proposing to modify the TPS maximum to be 110 such that the numeric score range would be 0 to 110, requesting stakeholder feedback on additional health equity changes to the hospital value-based purchasing program scoring methodology for future consideration. Long-term care hospital quality reporting program. The long-term care hospital quality reporting program is a pay-for-reporting program. Long-term care hospitals that do not meet reporting requirements are subject to a 2 percentage point deduction in their annual payment update. In the fiscal year 2024 Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System Proposed Rule, CMS is proposing the following. Beginning with the fiscal year 2026 Long-Term Care Hospital Quality Reporting Program, CMS proposes the adoption of the COVID-19 vaccine percent of patients/residents who are up to date patient/resident level COVID-19 vaccine measure. The measure reports the percentage of stays in which patients in a long-term care hospital are up to date with their COVID-19 vaccinations per the latest guidance of the CDC. Data would be collected using a new standardized item on the LCTS. The measure has the potential to increase COVID-19 vaccination coverage of patients in long-term care hospitals. Beginning with the fiscal year 2025 Long-Term Care Hospital Quality Reporting Program, CMS proposes the adoption of the Functional Discharge Score or DC function measure. This assessment-based outcome measure assesses functional status by assessing the percentage of long-term care hospital patients who meet or exceed an expected discharge function score and uses mobility and self-care items already collected on the assessment tool. The adoption of this measure would replace the top-down process measure application of functional assessment and care plan. Beginning with the fiscal year 2025 Long-Term Care Hospital Quality Reporting Program, CMS also proposes to update the COVID-19 vaccination coverage among healthcare personnel measure in alignment with the hospital inpatient quality reporting and PPS exempt cancer hospital quality reporting programs. Beginning with the fiscal year 2025 long-term care hospital quality reporting program, CMS proposes to remove the application of percent of long-term care hospital patients with an admission and discharge functional assessment and a care plan that addresses function, application of functional assessment/care plan measure. CMS proposes this measure's removal because it meets two removal factors described at Title 42 Code of Federal Regulation 412.560. First, the application of functional assessment/care plan measure is topped out, meaning performance among long-term care hospitals is so high and unvarying that meaningful distinctions in improvements in performance can no longer be made. Second is that there is an available measure that is more strongly associated with desired patient functional outcomes. Beginning with the fiscal year 2025 long-term care hospital quality reporting program, CMS proposes to remove the percent of long-term care hospital patients with an admission and discharge functional assessment and a care plan that addresses functional assessment/care plan measure. CMS proposes this measure's removal because it is topped out. Beginning with the fiscal year 2026 long-term care hospital quality reporting program, CMS also proposes to increase the long-term care hospital quality reporting program data completion thresholds for the LCDS data items. CMS would propose long-term care hospitals must report 100% of the required quality measured data and standardized patient assessment data collected using the LCDS on at least 90% of the assessments they submit through the CMS designated submission system, an increase from the current 80% of assessments requirements. Any long-term care hospital that does not meet the proposed requirement that 90% of all LCDS assessments submitted contain 100% of required data items will be subject to a deduction of 2 percentage points to the applicable fiscal year annual payment update beginning with fiscal year 2025. Beginning with the September 2024 Care Compare Refresh, or as soon as technically feasible, CMS proposes public reporting of the transfer of health information to the provider (PAC) measure and the transfer of health information to the patient (PAC) measure. The measures report the percentage of patient stays with a discharge assessment, indicating that a current reconciled medication list was provided to the subsequent provider and/or to the patient/family/caregiver at discharge or transfers.
This is it for today. Thank you for joining me. If you found this information useful, please consider subscribing to my channel and leave me a few comments. Hope to see you next time. Bye now.